A blood test for colon cancer is showing promise at detecting that disease. In a study of more than 10,000 colon cancer patients, the test was able to detect disease with an 83% success rate. For now, colonoscopy screenings are the recommendation for people 45 years of age and up, but medical experts say this blood test could provide a more appealing and convenient option.
The idea of a blood-based test is something they're used to having done, and that can be done part of their routine, medical care. I think that will encourage more people to be screened, which I think is good news.
Yes, there is a blood test already approved for patients, but it is not covered by insurance. It costs about $1,000 out of pocket. Developers hope this new test will be accurate enough to be covered by private insurers along with Medicare and Medicaid. It's a battle Ohio's been fighting now for years. Nearly 5,000 people died of drug overdoses in the state in 2022, with opioids, in particular fentanyl, playing a role in the majority of those deaths. Ohio's still fighting back, getting help from the CDC now to do just that. News 5's Maya Lockett shows us how Cleveland and Cuyahoga County are using that help to work together to save lives in the opioid epidemic.
Since 2017, have been experiencing about 650 or more overdose deaths.
Becky Carnes is the supervisor of Cuyahoga County Board of Health. The Board of Health received $2.8 million from the CDC to help prevent overdoses in the community. The funds from the grant went to multiple organizations in Cuyahoga County who help connect people to treatment and studying data to make sure they are reaching those who are most in need of care.
One of the things that we're noticing in our data, unfortunately, is that African American and Hispanic communities are experiencing really high rates of fatal overdoses. So we are trying to make sure that we are coordinating our work, and we're intentionally reaching out to different populations and agencies.
The Cleveland Health Department is helping in that fight. They received a $25,600 grant from the county for their Office of Mental Health and Addiction Recovery Services that help families who struggle from addiction.
It's been something that's been really devastating because it's kind of unpredictable in terms of who it will impact.
Lita Wills is the Commissioner of Health Equity and Social Justice. She says the grant will be used to partner with city recreation centers to host addiction workshops, provide screenings to assess for depression or substance abuse, and educate residents on treatment options.
And so what we're trying to prevent here is deaths by overdose. And so the more that we can educate people that it's out there and how dangerous it is, we're hoping to be able to head some of that off.
To expand their impact, the department is also working with Metro Health Hospital and risk management to provide naloxone in City Hall and rec centers in the county.
We see it across all ages, really, and our feeling behind wanting to make sure that we had naloxone and Narcan available in city buildings is really to kind of make sure that it's within the city's purview.
The grant money will also be used to train Cleveland City Hall and rec center staff on how to give someone who is overdosing naloxone, possibly saving a life.
She told me that people can expect to see the medication at the rec center and at City Hall in just a few weeks. And one of the pros of having this medication at the rec center is that there is almost one in every neighborhood. Reporting in Cleveland, Maya Lockett, News 5.